Good evening, everyone.
Today, Rashmi has also joined me. I am Dr. Anupama Santosh from Shrestha Ayurvedic Center. I am an Ayurvedic fertility specialist and a Panchakarma specialist at Shrestha Ayurveda. We are a 25-year-old Ayur family clinic in Kormangla in Bangalore. And our work always includes diet and nutrition work, lifestyle changes, all of which we are never, our prescription always has all these components to it. And I have worked with Rashmi. She's a integrative nutritionist who's been mentored with me and Dr. Santosh of the Ayurvedic way of diet and nutrition. And along with Rashmi, I have had several success stories with fertility when we have worked both together because she handholds all my fertility patients. Today we were talking about resolving constipation and about constipation. So whenever my fertility patients walk in, my treatment always starts with gut health. Uh, it for everyone without an exception. And many times my patients wonder that I am speaking about bowel movements and gut health and acidity more than estrogen, progesterone, and AMH, and they wonder why I'm doing that, probably wasting their time. But let me tell you this powerful secret behind, starting with resolving gut health, which leads to better diet and nutrition, better health, better overall health, and obviously better reproductive health. So nowadays, most of us know about Vata, Pitta, Kapha and how the balance of all these three doshas are very important for our overall health. And there is one kind of Vata dosha called as the Apana Vayu, which is responsible for all the functions in the pelvic region. And it includes everything, your bowel movements, your bloating, gassiness, and functions like menstruation, ovulation, conception, all of it. So, while we cannot really look into your ovulation or other changes in your reproductive system directly, bowel movements is something we can observe every day, and this gives me a window into the action of your Apanavai. Okay, interaction of the Panavayu, which again governs all your reproductive functions in both male and female. So correction of the Apanavayu gives me not just a window about your gut health, but also about your reproductive health. That is why the starting point is always that. And constipation seems to be, or changes in bowel movement and constipation seems to be a very common complaint of many of my patients, and this is where I dig in deep, and along with Rashmi we work with, in a very detailed manner to understand where the constipation is coming from. In my more than 22 years of experience, I also see that, recognize that people don't really understand constipation other than not passing bowels. But it can be so many other things as well. For example, when I ask them about bowel movements, they tell me, yeah, I drink, no, I don't have constipation, but I drink 2 liters of water in the morning and then I pass motion. Or I have to take a hot drink. I take a cup of coffee and then I have. Or I will not have a bowel movement or a complete bowel movement if I have not had enough water or enough fiber or a particular thing. What people are not understanding, what I realize is that they don't understand this is a band-aid approach, or this is just a coping technique they have understood which helps their bowel movements, but something as natural as an early morning bowel movement is not happening on their own. So that also I put it under the bracket of constipation. Or if they do not have a complete bowel movement, even that I put it under the bracket of constipation. So constipation turns out to be a much layered and much a nuanced condition than just being able to pass motions in the morning. Okay, so let's say you didn't have water for 2 days, or you didn't have a particular fruit, or if I didn't have a particular vegetable, or I didn't have a particular amount of fiber just for a couple of days, and it ends up with not having a proper bowel movement, still means that you should consider looking deeper into it and correcting the cause of the constipation. Not just not having passing bowel movements is not just the definition of constipation. So I just made a few points about what causes I usually see in my practice, which can lead to constipation. And sleep. Sleep is a very, very big and very underrated cause for many of the gut health issues. And water consumption, of course, and fiber, which is very well known, and acidity, lack of exercise, and stress and emotional component to constipation. And having very bland food with very few spices, or having a lot of spices, and having dry food, the food is lacks moisture and there's lack of fats in it, and or having the food with the same taste, same nutrition in the profile every day, it can be. And to also tell you the connection between the fertility and, let's say, fertility and constipation, many women have noticed changes in their bowel movements in the days leading up to the period or during the period, or gassiness or bloating. And sometimes when there is amenorrhea, that is delayed menstruation, sometimes I just correct, they give them a laxative and allow the apanavayu to flow, to move, and they get their period. Many, I mean, if they think back, many women can see the connection. Some of them have looses during their menstrual cycle. Some of them are severely constipated during that, and they also experience pain during that time. So if we think of all these things, we can see the connection between the our constipation, that is our bowel movements, and fertility and menstruation and periods and all that, and not look at it in a very isolated way. And now I invite Rashmi to give her her experience with people who are struggling with constipation, and some of the remedies. The remedies not always, in terms of medicine or home remedies, also to look into what may be causing. There are so many non-food related causes, like we discussed, which can cause constipation as well. Rashmi, give us an insight about this, please.
Yeah, hi. Hello everyone. Thank you, doctor. That's actually a lot of valuable information right there. So let's look at each of these causes that you mentioned, the doctor Anupama mentioned, and see what we can do to resolve constipation. The first step is sleep. Like doctor mentioned, sleep is extremely crucial for having proper bowel movements, and also, basically sleep puts us in a parasympathetic mode where our body is in a state of relaxation, and only then the natural urge can come up in the mornings, especially because if we are in a state of constant alert or constant stress, our body is only trying to survive, and it will generally not feel any sensations. So when we are actually focusing on our sleep, getting good sleep between 10 and not later in the night, so that is when the sleep hormones and relaxation rejuvenation happens. So if we can have a very good sleep, it actually helps us heal, resolve constipation. And then also maintaining a gap between our you know uh, dinner and sleep is also extremely crucial, at least a minimum of 2 hours between dinner and sleep. And ideally it's better to have an early dinner, at least max by 8 o'clock, 8 p.m., and then sleep after 2 hours. That is very very good for the biological clock
Correct.
to set in. And then water being another cause. So we need to keep ourselves hydrated well. So it's around 30 to 40 ml per kg body weight, but not all the water at one time. We'll have to spread it across at equal intervals. And I also constantly hear people say that they drink a lot of water first thing in the morning. So ideally it should be spread out and not more than 200 ml at one time. So also we should avoid.
Sorry, sorry. No, I just want to add that this drinking water in the morning, they do not, we should consider that the Agni is ready for food in the morning. So if you are just dousing that fire, Agni is a digestive fire. You're pouring so much water inside that fire and extinguishing it, and then having the breakfast later is only going to cause more indigestion, which again is a vicious cycle of, and so don't drink too much water in the morning. and spread, like you're saying, no, the 30 to 40 ml per kg body weight should be spread throughout the day. That's what I wanted to add. Please continue.
Yeah, that's right. So, and we should not actually drink water immediately after having our food as well. It's again dousing the fire or the acids in the stomach. So, this is one way to also resolve constipation. The next is fiber. Actually, too little fiber or too much of fiber both can cause constipation. I mean, we all of us know that too little fiber in our foods can cause constipation, but many of us might not be aware that too much of fiber also can cause constipation. For example, millets or salads have a lot of fiber in it, but some people cannot really digest them the way it is, and some people also face constipation. So millet itself is, each millet has a different property. So millets are very rich in fiber, very nutritious. So for beginners, I would suggest you can go through doctor's video on YouTube on millet for beginners, and that starts the preset of how we can start consuming millets. Ideally, the easy to digest millets are barnyard millet or ragi and little millet to start with, and always have one millet at a time and notice how you digest it and how you can really feel having that food. And basically, we need to listen to our body. It's not like something is good or something is bad. So, or we should not just blindly go by what somebody is saying is good for constipation. We need to really understand what is my body trying to tell me and how am I feeling eating a certain food. And because everything has different properties and has different effects, we are all bio individual beings. Each one of us are very unique, and what works for me might not work for you. So understand that we are different and we are very unique, and what is that I need to do to resolve my constipation or any other acidity or anything else. So it's an
It's a very
inner journey
valid
that
point
we have
about this fiber thing, because I sometimes I see patients who are very surprised that they're eating salads and they're having constipation. Okay, sometimes when there is a lack of peristaltic movement, which is again a vata function of the vata dosha, when you burden it with so much fiber, when it's not able to move even with small, little less fiber, and you burden it with too much fiber, they'll have more constipation, because salads are considered to be the most healthiest food on the earth. So, while forgetting that we are all bio individuals and my body may not like salads like somebody else's body. In the same family, I have heard so many times, I've told them that no, it's not necessarily healthy for you. It may be healthy for somebody else. So it's a very valid point you said about, everybody being a bio individual, and you should understand whether it's working for you. There's nothing universally good for everyone. It's not possible.
very true. Yeah, it's a good idea to rotate your grains, rotate your vegetables, have a variety. Like you said, it's the same food every day can also be causing the problem. So, and also bland food sometimes can cause constipation. Basically, we need certain spices for our food to get digested. For example, fresh ginger, ajwain, so cumin. All these are very good spices to help in digestion and also in peristaltic movement. Um Doctor, you want to add the Ayurvedic perspective on this
Yeah,
foods?
yeah. Ayurveda hugely subscribes to different tastes. Actually, we have six rasas: Madhura, Amla, Lavana, Katu, Tikta, Kashaya. We are supposed to have all those rasas, all those tastes, because all of them have different properties in each meal. But of course, in different proportions. But it should all be there. No, thinking that only bitters are good, or thinking that only let's say bland food is good. Only Madhura is good, that is sweet food is good, naturally sweet food is good. Because every part of our body needs different kinds of nutrition, and incorporating all these rasas, all the shat rasas, that is six kinds of taste, also adds to better hunger, appetite, better digestion and better bowel movements.
Wow. Yeah. Yeah, the next thing we need to also look into is, do I have acidity? Because acidity can also be leading to constipation. So we need to see if there is acidity. You can also refer to our video on acidity, which we had previously done on Insta, and it's on the YouTube as well in Shrestha Ayurveda channel. So understanding if there is acidity brewing and then addressing it also can help with constipation. And another very important aspect is having dry foods. So that's the cause that doctor mentioned. So we need to consume warm, moist foods for better digestion and better peristaltic movement. And also we need to have good fats in our foods. So good fats are extremely crucial and essential for again the movement, bowel movement and digestion. So include a lot of nuts and seeds and then ghee in our daily diet. So that can help with constipation. Also, please remember these are all generic suggestions. So it could vary from person to person. So these are very generic. And then the most important part of again resolving constipation is lack of exercise. So including exercises and stress management, both of this. So exercises can help in the peristaltic movement, bowel movement, and better digestion as well. So even yogasanas like malasana is very very useful if people are suffering from constipation. So it's extremely helpful. And stress management, there is always this gut and brain connection. So we might have noticed during exams or any stressful conditions, we either notice some constipation or loose motions happening. So there is always this stress that is connected to the gut. So we need to address this as well. Very, very important aspect. So there could be, emotions like fear, nervousness, anxiety, or lack of expression. Because of all this, also we could be constipated. So these are also things to look into. So basic lifestyle changes like chewing our food slowly and chewing it well while we are eating, deep breathing, meditating. All these lifestyle practices can help in generally to resolve constipation and many other health issues. So we might also notice that when we are traveling and when we use different toilets, you know we could see that we are constipated. So there is a lot of this gut and brain connection, emotional connection that we see that's happening. So these are all the few things that we can actually do to resolve constipation. Other remedies we could generally do is to drink hot water with a spoon of ghee just before bedtime. That is really helpful. And then soaking raisins or prunes for 2 hours, and not more than 2 hours is 2 hours is enough, and then consuming it can also be very very helpful. So these are a few remedies that really help in resolving constipation. Like I said, each one of us are very unique, so we need to dig deep into each person's health history to understand what is really causing the constipation. But this could be in general very beneficial to all of us to resolve constipation.
Finally,
Thank you.
it is like you keep saying, Dashmi, and I'm very impressed with you, what you keep saying, telling all the patients that it is an inner journey. you to make that inner journey. Whenever many of my patients ask me, is this a long-lasting prescription or is it a long-lasting treatment? The longest lasting treatment is always the inner journey we take inside ourselves to understand what my body agrees, what it does not agree, how does it express when it does not agree with something. How can I help my body? Can I listen to my body? In terms starting with as simple as food and sleep and emotions, that is when you really realize that, okay, this is what my body wants. And then you arrive at your own personal prescription or your own personal food and lifestyle guide for yourself. After taking guidance from me, taking guidance from you, I think that is the prescription this we are trying to give all of them, that to make that inner journey within themselves so that they can arrive at their own guidance, their own guide to their own health.
Absolutely.
Yeah. Okay, I think we have given some idea for people to start their inner journey towards resolving constipation. Let's meet again to discuss other things about gut health and fertility later.
Sure, doctor. Thank you.
Thank you, Rashmi.